So there I was, belly shaved.
Yeah, been there. Undignified, isn't it?
I know exactly what you mean. Right, well, until next time.
Oh.
Smell you later.
Bye.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Here she is, the puppy with the best haircut in town.
Just make sure you're not swollen under there.
Known as a nation of animal lovers, the UK is home to 36 million household pets, 12.5 million cats, 13.5 million dogs, and not to mention all the other creatures, great and small, that we welcome into our families.
And in this series, we'll be finding out what happens when our fur-legged friends are in need.
I'll meet their devoted owners and the expert staff who treat them. From the routine...
Blooming brilliant, aren't they?
...to the life-saving, and everything else in between.
Oh, thank you very much.
We'll capture the intense bond between owners...
You're doing good, Baba.
Doing really good.
...animals and the vets. And we go outside the vets to meet some little life changers.
She's like a fluffy miracle, and I'm extremely grateful to guide dogs. I'm extremely grateful to Luna.
So, join me, Fern Britain, on a roller coaster of emotions inside the vets.
Three miles from Bristol city centre is the neighbourhood of Henlees, and it's here that Andy and Amy Valencia run the Grove Vets.
So he's quite sleepy now.
Alongside Dr. James Greenwood.
Oh, look at you.
Together, they care for the precious pets in their community, offering their owners advice and nurturing their animals back to health.
I'll give her cuddles. I'll look after her today.
Thank you.
Sadly, for now, I've reached the last few days of my tenure at the vets, but I'm still taking my assisting duties very seriously.
Can I do anything else? Mop your head?
I'm going to say something along the lines of that.
Our passion for pets is so strong that 65% of people say that having a pet is as significant a milestone as having children.
You're a good girl.
And it so happens that the city of Bristol is the UK's pet capital, with 76% of Bristolians owning one. So it's no wonder the Grove Vets, in a busy period, have around 40 patients a day.
Morning. What
Morning.
have we got today?
Well, we've got quite a busy day today. First of all, we've got Nico coming in. He's coming down for a sedation for some x-rays.
Dog, cat, what?
Cat, British Shorthair, lovely big boy, beautiful cat. He's really, I think you'll like him. He's a bit of a stunning. Then we've got Dobby, very cute. He's a border terrier, so dog, coming down for a castration. We've also got a really busy day on consults. I mean, anything could come in at any point. So we're kind of just, you know, starting the day and literally anything could happen.
The first feline of the day has arrived to see James and me.
Nico came to see me about a week ago and he'd had some sort of accident. Owners weren't completely sure exactly what happened, but they did see him fall from a garage roof. And since then, he came back home limping, right hind very sore, big bushy tail, lots of vocalising, lots of yowling, clearly quite painful. They brought him down to me a couple of days afterwards and he was still definitely not himself. He's had some anti-inflammatories, but there has been some intermittent lameness still there in that right hind.
Hello, Nico. He's so handsome,
He's
isn't he?
gorgeous, isn't he? He's a big boy as well.
He is. So what are you going to do today? This is his second examination.
So we've got him back today, basically to obviously give him a quick check over, just to double check to see if there's anything else going on.
Well, he's going to be well looked after by you, isn't he?
Yeah. I mean, he looks pretty chilled there. It's quite encouraging that he's able to manipulate underneath the table.
Yes, did you see
that?
that?
That's a good
Yes.
start. Let's see. Now then. you going to do some walks for us? Anything?
No, I'm going to go on here.
Right. I wonder if I try and walk him towards you. If you...
Yes. Come round here. You saying, do you want me like this or do you want me like this? Hello.
Okay. Excuse me. We're trying to do some work here.
Come on, pussycat.
This is the thing with cats. You can only go at their pace, can't they?
Absolutely.
Okay. Cats are very, very good at basically coping. So they will kind of find ways to cope with the pain when actually behind the scenes there's quite some, quite serious injury there.
I hope he's insured, is he?
So he is insured, and that's one of the parts of insurance is that it sort of enables me to then do the investigations that we need to do. So the next step is we're going to do a sedation and then I'm going to take some x-rays.
I know cats never do as they're told, so hopefully Nico will succumb to James's charm later. The main reason more than 50% of pets visit the vets is for either vaccinations or routine health checks.
Good girl. Very brave.
But this young Cocker Spaniel has recently had more than her fair share of appointments.
Naya is a 20-month-old Cocker Spaniel. We've had her from 8 weeks old. When Naya first joined the family, it was like having a newborn baby. It's a lot of sleepless nights and worrying and making sure you're looking after her correctly. And now nothing's changed. I adore her. I wouldn't be without her at all. She's so loving. Nothing loves you the way your dog loves you. We couldn't be without her, really. She's so much a part of the family.
Naya is clearly adored by Ruby. But a few weeks ago, she began to worry as she discovered a lump on Naya.
She's had spots before and we've given her baths with medicated shampoo and that usually gets rid of it. But this one was protruding through her fur. My daughter was like, Mum, this is getting bigger. It really frightened me, the fact that, our little puppy that we've only had for 20 months could have cancer.
Concerned, Ruby immediately made an appointment at the clinic. And today, Naya is back to see James, Nurse Alice and me for further investigations.
Look at her little mop top hair. Look at that.
She's come to see us today for a scan. If you just have a little look here on her back, can you see just where the fur part's there?
Small.
She's got this small little lump that's just come up in the last few weeks.
With your vet eye, does that look anything weird to you?
The few things that would immediately come to mind in a young dog, one would be a histiocytoma, which is a type of benign lump that can come up on the skin. Normally we see it on extremities, so maybe feet, legs, ears, face, and they kind of come up like little, sometimes they look like little bright red sweets, but they'll often go away on their own, whereas this has been present now for almost 8 weeks, which is a little bit of why it's concerning. So that's really what I want to rule out today, whether we've got something that we need to then either do a physical biopsy or possibly even surgery.
Okay.
It's fairly common for dogs to get lumps and bumps on their skin. They can range from benign, like a cyst or a wart, to serious tumours. So it's always important you contact your vet, even if you think it looks harmless.
So what we're going to do, we're going to place a scanner onto the lump itself. But in order to get a decent image, we need to take the hair off. Okay, so I'm going to do that first. Okay, so...
This scanner is a new bit of kit then?
Yeah, this is a really clever bit of kit that uses a combination of a special type of heat and AI, artificial intelligence, to give us an idea of how much of a problem this lump potentially is or isn't.
Statistically, if the scanner says a lump is benign, it is right 98% of the time. If it has a low score, that will suggest it may be malignant. And then the vet will need to investigate.
So we're ready to do the scan. And if we pop the scanner on, we just need to then hold that, if we can, for a minute. Good girl, good girl, good girl, good girl. Look here.
Oh yes, I can see it on the screen.
So that's now analysing the data to work out the difference in the heat pattern that the scanner's picked up from the lump itself.
She's only really interested if you can tell us that we've got some more of this tube of liver pate. That's what she wants.
She's very happy there.
Yeah.
One of the advantages of this new piece of equipment is that it will give us Naya's results in a matter of minutes.
We grade lumps from 1 to 10, 10 being the best result, so that's completely benign, and we would almost be confident to say We don't need to do anything more. But slightly worryingly, this has come back with a score of 1, which would indicate that actually that's potentially quite a malignant or aggressive lump. So I am very not happy. I think even though she's only young, I think we do need to do some further investigations here.
Oh, I'm sorry, that's bad news.
We know that there's justification to pop a needle into the lump to create some smears, to get some samples.
James now takes a fine needle aspirate. When a needle is inserted into the abnormal tissue to collect a sample of cells for microscopic evaluation.
So you can just see on the surface of the slide, we've got this sort of smear of those cells, so we can get them sent away to a pathologist.
Good. Well, let's wait and see what happens
Keep
next.
fingers crossed, yeah.
It's not the news we wanted. Now James will notify Naya's family, and all they can do is wait for the results.
You've been a very good girl. There might be a little bit more we need to do.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
No one wants to have a poorly pet, but keeping your eyes peeled for telltale signs that your animal isn't well is crucial. And notifying your vet quickly could speed up recovery. Our next patient today is Dobby with his owner, Jenny.
He's a border terrier, is he?
Little border terrier, almost a year old.
Yeah, they have great personalities. I had a border terrier.
Did you?
Yes, I did.
Yeah, they're
he was an
tremendous.
escape artist, though.
He's not too bad.
And what's he here for?
He's having his testicles removed because
Oh.
he's only got one, descended.
Okay.
We call him the one-ball wonder. But so they have to be removed if they're not descended,
Oh,
as I
see.
understand it.
All right. So they're going to
good boy.
operate today.
They're operating today.
Well, you're going to be all right, aren't you, mate?
Yeah, I'll be absolutely fine.
Yeah, you're a good boy.
In charge of Dobby's operation today is vet Amy and veterinary nurse Ella, who will be monitoring his general anaesthetic.
We're just going to put a cannula into his vein so that we've then got access to his vein to knock him out.
A testicle that hasn't descended properly is known as cryptorchidism. It's believed to be an inherited condition and affects around 1 in 10 dogs.
So this is Dobby's retained testicle here.
Ah,
So you
this
can
is the
just
one
see-
he's got.
So that's the one that's down in the scrotum, so
There's
that will be
someone-
the straightforward one to remove. And then the other one is here. So you can probably feel it, yeah.
Oh, yes.
Because it hasn't descended fully, it's at a higher temperature than it should be, so it's at risk of cancerous changes, which is why we need to remove it.
Yeah, because they have to be outside the body to cool down.
Yes, exactly. So I'm hoping that I'll be able to do it just through one incision.
That's amazing.
Which means that he'll have fewer wounds to heal,
Yeah.
less risk of infection, he'll be more comfortable.
Poor lad, look at him. And he won't remember anything about it.
No, he'll just wake up a bit surprised, wondering what's happened.
Dobby, I'm so sorry, darling. He's well under now, though, isn't
He
he?
is,
He's
can't
absolutely-
feel a thing.
Yeah.
So we just clip it up, make sure it's all nice and sterile.
Dobby is now prepped and ready to move into theatre. We're not required to mask up for this procedure. Anything more than a skin incision is when it's recommended to avoid infection.
You've all got your hats on. If I'm doing this properly... You'd tell me if I looked ridiculous, wouldn't you?
Amy will remove the descended testicle first, then proceed with the one that's retained, which could be a bit trickier.
So you've made the incision.
Make the incision.
You've popped out the one...
Popped. So this is the
Descended.
descended testicle.
Yes.
So that's the testicle there and all the blood vessels and spermatic cord. We use a little clamp.
Right, that stops the blood
So that
coming
stops
through.
the blood, yeah.
Right, and then snip.
So I put 2 on. So I just have to use some suture material first to tie the blood vessels off.
And is this one of the early operations that you learn when you're at vet school?
Yes, one of the ones that we learned very early on and then practiced as qualified vets.
So you and Andy and James, did you all... I know you were all at vet school together.
We were all at vet school together. So James actually graduated the year before us.
Isn't it marvellous? The three of you have remained such a good unit.
Yeah, it's really good. So that's one testicle removed.
Looks as if it should be in a dumpling. Now I've got to find the missing one. Dear Dobby, you're doing well, mate. You can feel it?
Yeah.
Is it coming?
Yeah, it will. Ooh. So it is a little bit more fiddly because there's a bit more soft tissue.
Well, I don't think I can look at that at the moment. That's kind of quite red, should we just say. It's making me feel a bit uncomfortable.
There we go. Phew. So there we go.
There it is.
There's the second testicle. Quite significantly smaller than the first one.
So that's it, it's done?
Yeah, it's done. Both testicles removed. Just the stitching up to do now.
Earlier, 20-month-old Cocker Spaniel Naya had cell samples taken from a lump on her back. Concerned it could be cancerous, the results have been fast-tracked and have been emailed through to James.
Should we open it now?
Yeah,
Should we have a little
you read
look?
it out to us.
I'm a little bit worried about what we're going to find, but let's have a look. Moderately cellular, discrete round cell population. It's a moderate. Ah.
Are you smiling?
We have some good news. This is good. Right. Okay. Okay. Good. Right. Okay.
Tell us about it then.
So this is,
goodness.
you know, the roller coaster of veterinary medicine. So we've got a canine cutaneous histiocytoma. So this is a benign type of cancer that affects young dogs. So that fits with what we've seen. A single lesion with rapid initial growth. It can become painful as well. So I think as it hasn't regressed on its own, I do wonder whether we still might consider surgery here to remove it. And as long as we get rid of that lump individually, then all should be good.
Wow.
So this is what we like to hear. This is great news.
I suspect his owner, Ruby, has not slept much last night. Naya was so beautiful, and this is great news. And Ruby will be just overwhelmed. What a blinking roller coaster this is!
Can we just turn him over?
British Shorthair Nico is about to have an X-ray to help James determine why he's showing lameness in his back legs.
He's such a beautiful cat.
He's been given a mild sedation to keep him still and is under the watchful eye of vet nurse Ella.
Although he looks a bit forlorn lying there, and people might think, oh, poor thing, he's actually just sound asleep and relaxed.
Yeah, I mean, in his world at the moment, he's chasing butterflies, he's sort of got all the cat food he could want, he's as happy as Larry.
I've realised that X-rays are an important part of diagnostics, allowing the vets to plan the next step of the treatment.
Okay, if we have everybody out, we'll take these X-rays. Okay, X-rays. Right, that's beautiful. Let's see what that shows.
As soon as the X-ray images come in, there's concern, and James asks fellow vet Amy for her opinion.
It's quite obvious that his right is sore, and then sometimes you almost kind of think his left has gone as well. My initial worry would be whether that pelvis has fractured, but I think that might be a bit of rotation.
Yeah.
But we've still got this over the femoral head. I just wonder whether this is a bilateral femoral head fracture.
I think so, definitely there.
It's not sounding too good for young Nico. While he slowly wakes up, I'm curious to know what that means for his future.
James,
Hi.
that looks like a serious consultation you're having with Amy.
Yeah, I am a little bit worried about where the hip joint here is connecting to the femur. So you've normally got the ball and socket of the hip joint.
Yeah.
Normally the ball connects to the femoral head, so the femur, which is our main leg bone, or the cat's main leg bone. Then that sits in the acetabulum ring, which is the kind of the sort of the cup of the hip joint. And what we can see here is where the ball is, and where normally then the would connect to the top of the femur. That sort of, we've got this sort of grey line on both sides, which I'm just a little bit worried about whether that is actually a fracture. So essentially the ball has fractured off the bone.
On both sides?
On both sides.
Oh.
Yeah, yeah.
What do we do next?
Well, rather than a full hip replacement, we just take the bones away because it's the bone on bone that hurts.
Yeah.
Then the muscle around that back leg can sort of build up to try and
Secure it
support
again.
and secure it. But if he needs that on both sides, I don't think we're going to be able to do that under one operation. So he'll then need 2 operations, 1 on each side of the hip. I'm going to ramp up his pain relief quite significantly, and he's also not going to be allowed to walk around very much. So I'm going to suggest that we keep him confined in a small area until we've got a plan for surgery.
Okay.
The first patient to arrive at the vet's this morning is Cocker Spaniel Naya. She's returned with her owner Ruby, ready for her procedure.
So what's James told you is going to happen today?
So today they're going to actually remove the bump that's on her back. The fact that it's just where it is and there's loads of skin to play with, it'll be an easier operation to do on her.
Well, let's hope that this is sorted out quickly.
Fingers
and then
crossed,
You're going to drop her off now and then get the phone call later to say come and get her.
Yes.
Good, good.
Perfect.
Well, I'll be with her when she's in there, I think.
Thank
so,
you.
yeah, she's a lovely dog.
Thank you very much.
Don't worry.
Thank you. She's in good hands.
Naya's lump removal will take around an hour. James will be assisted by veterinary nurse Ella and, of course, me.
Okay, got a little job for you. If you want to pop some gloves on, we can prep the skin, which is how we make sure that the skin is nice and sterile for surgery.
Yeah.
So we take some cotton wool with our antiseptic solution. So this is chlorhexidine. So that means that it will sterilise the skin. And what we do is you start in the centre, so where you're going to actually make your incision, and then you just make a few sort of sweeps around like that. And then the most important thing to do is always work from the inside out. So then you slowly extend your sweeps out to the edge. But the most important thing then is to stop there and don't go back in, because we don't want to bring infection from the outside on top of the wound.
Because now that's contaminated with what you've wanted to get rid of.
Exactly, so we put that to one side, start with a new ball of cotton wool, and off we go.
Oh, gosh, how exciting.
That's it, so if I hold the skin,
Yes, thank you.
that can help. Great, thank you.
I enjoyed that.
There
Thank
you go. There's a nurse in you yet, you see.
With the prep now done, Naya is moved into the theatre.
So,
Making the incision?
yeah, I'm going to make my incision starting here.
There's a little bit of blood now. You might not want to see that. But it's all okay. And Naya's okay. Can I ask you how deep you have to go?
Yeah, so with this lump, because we know what the type of lump it is, I only really actually need to go just under the skin. So I'm taking the full skin thickness, but I don't need to go right down to muscle, which is great.
Right. I'm stroking her little foot here.
Oh.
It's for my comfort, I think. Dear little girl.
So basically what I'm trying to do is make sure I've got a nice amount of normal tissue around the lump itself, because if I'm too neat and too close, we risk leaving a little bit of the lump behind.
Yeah.
So you've got to take enough that you're happy we've got all of the lump, but not take so much that we're creating an unnecessarily big wound.
There it is.
Go.
Out.
So we'll put that into a pot.
So
There you go.
that'll be sent off.
That gets sent off to the pathologist. They'll section it, have a look under a microscope and tell us exactly what type of lump that is, what type of cancer. Hopefully it'll come back as a histiocytoma. So that's nice and benign. And then we could, fingers crossed, we can say that that's been curative and we don't need to do any more work.
Brilliant.
Now I'm going to put some stitches into the skin itself, just to close that last little gap.
Does it take long to learn this stitching?
Do you know it does? And it's something that I can remember as a student. We all used to get pieces of orange peel or, you know, anything that you could sort of pass a needle through. And we'd sort of be sitting there trying to practice our various stitching techniques. Because there's different stitches for different purposes and all sorts of different techniques you can use. It does take a bit of practice to get up to speed with it.
When they put their trust in you like this, it's quite humbling, really, isn't it?
Yeah, I think part of the big joy is that it is a real privilege to be in people's lives like that, because pets do just mean so much to us.
They do. They really do.
I can feel her waking up. Let's go through. There we go.
Well done, Naya. There she goes. There she goes. Isn't that incredible? It didn't take very long. And now she's going off to wake up quietly and gently in her warm kennel. And then we'll see her later. Well done, Naya.
Coming up, Nico will be taking the first step of his treatment.
It's still a very difficult operation, but there is a little bit more on our side.
And we go outside the vets to meet some little life changers.
Just the thought of being able to go for a walk and enjoy that walk, unassisted by another human, was really, really appealing.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
It's a big day for Nico, as he'll be undergoing major surgery on his fractured hip.
He's so handsome, isn't he?
He's already had his pre-meds, so James and Nurse Alice can now prepare him for surgery, administering the anaesthetic and clipping his fur. As this is an advanced procedure, veterinary surgeon Andy will be leading this complex operation.
It's going to be probably ideal if we can get the cat further up this end of the table.
Although both hip joints are fractured, he will focus on the right-hand side today. The procedure is known as femoral head and neck ostectomy, and the aim is to restore pain-free mobility to Nico's fractured hip.
Problem is, whenever they've had a fracture like this,
everything's going to be just so contracted, isn't it?
Contracted. Because he's a British Shorthair, which means, you know, he's
got some decent thighs.
He's got some thighs on him, which is slightly getting in the way of our approach, but we're getting there. If you just get your finger in there, so there's pelvis, and then if you slide your finger up here, so we're just going to need to get the osteotome and start cleaning that up.
Andy needs to remove the ball of the ball and socket joint, which requires him to work around several layers of tissue.
It's still a very difficult operation, but there is a little bit more on our side, having found that we can sort of get to where we need to get to, basically. So we've got the ball of the femoral head off. If you imagine it a bit like a mushroom, we need to get the stalk of the mushroom off the leg bone as well to make sure we've got a really nice, smooth junction between the hip bone and what's left of the leg bone.
The operation takes 45 intense minutes to complete. To see if it's been a success, Andy needs to take an X-ray.
Are we in a position, team, to transfer to X-ray and keep our fingers crossed? X-rays, take him. That's right.
Nice. I think that's really smooth.
I think it's as good as we can get. I'm very happy with that.
Nice work. Nice clean line, really.
Nice clean line there. It's quite important that he starts moving around ASAP. So rather than crate rest, he's going to be on room rest. We're now going to have to do some aggressive rehab for a couple of weeks, then we're going to have to go and go in on the other leg, and fingers crossed that procedure goes as well as today's did. Right, job's a good one.
Interacting with animals has been shown to decrease levels of cortisol, a stress-related hormone, and lower blood pressure. So, pets really do change our mood.
Yes, yes, good girl, good girl.
But some animals aren't just pets. Many dogs are trained to take on vital roles from rescue...
Hi, service search dog, if you can hear me, call out! Oi.
...to guide dogs.
Good girl.
There are 2 million people living with sight loss in the UK, and guide dogs help those with a vision impairment by giving them support and confidence. Across the country, there are 21 centres like this one in Bristol that nurture, train, and match up guide dogs to the right owner.
Oh, you clever boy.
Puppy development advisor Sophia Haig has the task of teaching the new recruits in her weekly classes.
What I want to focus on is just doing a few basic sits, downs, getting their focus and attention onto you, popping a little bit of kibble on the end of their nose, pull it forward and see if they'll go into a stand. The puppies we've got in today, the youngest one is 10 weeks old and our oldest one is 6 months old. So they're still very much at the beginning of their training journey. At this stage with them, it's all about them sort of exploring the new environment, and also we've popped in some strange objects for them. So these puppies won't have seen these objects before. So I'm just interested in seeing their confidence levels, how responsive they are to their handler as well. We don't need to make them do anything they don't want to do, just letting them have a little explore.
Just like other dogs, guide dog puppies have regular vet checkups to prevent any health issues from becoming a reason they can't qualify for the top job. They've also got to master a lot of the techniques.
So Maisie's our youngest puppy, so this is a really big thing for her. Oh, she's doing so well, geez.
Guide dogs began transforming lives back in 1931. 2 innovative women from Merseyside, Muriel Crook and Rosamond Bond, started training dogs to support servicemen who'd lost their sight in the First World War. Over the years, it's grown from strength to strength, breeding their own dogs and enlisting puppy raisers to care for more than 1,000 little life changers each year.
I'm Martin and I'm looking after Lucy. Lucy is 11 weeks old and so far, so good. We had a couple of sleepless nights at the beginning, but she's sleeping through now, and she's just starting to learn to be a life changer.
Puppy raisers like Martin will care for these young apprentices for about a year, and during this time, the pups will undergo 24 weeks of training.
My daughter is a primary school teacher and she likens it to her class. She gets them in September and she knows there's going to be tears in July when they move on. It's very similar.
Once graduated, these pups will be matched with an owner, giving life-changing support. Dan Roberts was born with a hereditary eye condition, leaving him with total loss of sight in one eye and little vision in the other. This led to him being partnered with Labradoodle Luna 6 years ago.
Unless I was assisted by my wife and my children, I just didn't go out. It's not a great, healthy way to live. Luna is a perfect combination of clever and crazy. She's very aloof, extremely sweet, and she's just got a heart of gold. And I was very lucky that Luna thought I was all right. When I? Yes. Just the thought of being able to go for a walk and enjoy that walk, unassisted by another human, was really, really appealing. I didn't realise how amazing a guide dog could be in my life. Right, Lou, find the exit. Luna knows her left from her right, and she gets that right 100% of the time. She's got a vocabulary of like 70 words. She knows to take me to the gym, she knows barbers, she knows the shops on our high street. She'll individually take me to those different shops. You can't swagger when you're walking with a white stick. It just doesn't look right. But you can when you're walking along with your dog.
Luna's training and adaptability means she's a great source of comfort for Dan. She even enjoys going to work with him.
I'm a hotel singer. That's what I've done for 17, 18 years now. So we rock up, don't we? And we sing songs to people, and everyone ignores me and looks at you. She's changed my life in an extraordinary way. She's like a fluffy miracle, and I'm extremely grateful to guide dogs. I'm extremely grateful to Luna.
The next patient to arrive at the vets to see Andy is 6-year-old cockapoo Jobo and his owner Jane.
Go on, Joe.
Here he comes.
Right.
Jobo has a pea-sized lump on his ear, but because he's quite an anxious dog, Andy needs to decide how best to tackle the issue.
What I propose is we do a sedation. Once we have them sedated, we do a needle biopsy. If it looks cheesy, like a cyst, then we just remove it as a cyst.
Okay.
If that's not what comes out, we can basically make a slide of it and send it directly off to some pathologists. The option then is he doesn't need to go home and then come back on another day. As a nervous dog, he gets priority as, get him in, get him recovered, and then get him home with you as soon as possible.
Okie dokie.
How is he going to be with a little check over now? What we don't want to do is wind him up before we then treatment him.
Playing with you when
Yeah.
he first met you. Do you want me to unwrap him from the winter?
The thing that you've got, though, is dogs are smart, and he might be fun playing with me when he knows there's no ulterior motives. So you know what this is, don't you,
Yes,
mate?
he does.
You know what this
He's
is.
too smart.
It's fairly common for some dogs to show signs of anxiety. Exposing them to new things when they're puppies can help reduce stress in adulthood, but it's always a good idea to get advice from your vet.
And he's allowed to tell us that he's anxious, because of all the places, it's sensible to be a bit anxious.
Yes, it is. You're
It's
right.
when you
it's
come
right.
here,
It's like
you
we're
know.
going to the dentist.
Cool,
actually.
so let's go through this consent form. Right, does he have pet insurance?
Yes.
Yes, perfect. And who's he insured with?
Pet plan.
Pet plan. There we are, we're all ready to go.
You look after him. That's your instruction.
Listen, I promise.
Jobo is a priority today, so Andy is eager to crack on with the procedure, and vet nurse Ella is assisting with the sedation.
It does feel quite gritty.
Andy soon discovers that the lump isn't a cyst and takes samples. They are scanned and sent straight to a pathologist, and the results are returned within minutes.
It's come back as something called a trichoblastoma. So that is a benign in nature mass. They tend to grow with a bit of a cauliflower type appearance. We do really want to remove because where it's located behind the ear, they tend to get scratched. And if it ulcerates, then it can then get infected and then cause further problems.
It's good news for Jobo. And now Andy and the team can start the procedure. And as it's such a small lump, it's a speedy process.
Whoa, they are some meaty blood vessels.
Now the trick is getting this closed without nicking that huge blood vessel. Make sure this comes together nicely.
Joby being a bit of a sensitive soul means that we're making sure all of the sutures are kind of buried and they're dissolvable. So it means we're not going to have to remove them at a later date.
Cool, can I just get a tiny bit of skin glue, please, and then we're done. A bit of skin glue there.
The reality is it was nice and routine, and hopefully he'll recover nicely.
Uh-oh, vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Border Terrier Dobby's castration and retained testicle removal was a success. He can now be discharged and go back to his owner, Jenny.
Here he is.
Hello, sunshine.
Good boy, who's this, Dobby?
You've gone from the one ball wonder to no balls.
Hey.
Oh, I'm
Are
exhausted.
you tired?
Lie
It's been a
down.
big day, hey?
Yeah.
So it is really important that he doesn't lick, so I will get you a suit and a brush
get
collar.
me a suit and a collar and we'll see how it goes. Good
Here we
boy.
go.
Well done, mate.
Good boy. These aren't foolproof in male dogs because they often can
No,
still
I'll-
get past it, but at least it's a
I'll keep
little
it-
bit of a deterrent.
Good boy.
Super smart. What I'll do is I'll just tie it forward just because he's about to go outside. And,
Okay, he might cock his leg.
Yeah.
Well, in fact, he probably will.
He'll hopefully be quite happy in it. Most dogs take to them quite well.
As well as the protective suit, Dobby will have restricted exercise on the lead for 10 days to allow the wound to heal.
There's a good boy.
Great. Okie dokie, so we'll give you a ring to check in tomorrow and then we'll see him back in a week's time.
Come on then, sunshine.
Next to arrive at the practice are brother and sister Jojo and Billy, with their owner, Wilhelmine.
Hello.
Hi,
How are you doing?
Yeah, very good.
Hi, guys. Do you want to come on through? We're ready
Yes.
for you if you want to come straight in.
Come on, Joe.
The family are due to go on their holiday soon, so have made an appointment to see James.
So come down for their rabies vaccinations today, haven't they?
That's right, yes.
Yeah, great. What's your plans? Are you travelling with them soon, or?
Yeah, in the summer we want to take them in the car and we're
Yeah.
going to Scandinavia.
Have they travelled before?
Except from flying from the Bahamas.
Oh,
They
wow.
haven't.
What were they doing in the Bahamas?
We rescued them there. They were in a rescue home. And we picked them out, took them home, and lived with us for 3 years. And then we brought them back to the UK from the Bahamas.
Oh.
And so now they're going to have a holiday in Scandinavia. And
yeah.
you don't want a holiday without them.
No, absolutely not. We've done holidays here within the UK, and it's just lovely. They are family.
Taking pets abroad is on the increase, with almost half of dog owners planning, or have already been on, a doggycation. But many pets find the change in routine stressful. So always decide what's best for them and make sure you check the rules of the country you're travelling to, plus what vaccinations are required.
A rabies vaccination in the UK, a single vaccination is valid for 3 years. So we just do one today, then that as a vaccination will protect the dogs for 3 years from today.
Wow.
But interestingly, we need to then wait 21 days minimum before we're legally allowed to set up any sort of travel moving from the UK over into the EU or any of the other listed countries. Okay. But once that 21 days has passed, what you can then do is come down for what we call an animal health certificate, and then you need to then see a vet within 1 to 5 days of your return in that country to have a tapeworm treatment to be able to come back to the UK. So there are quite a few steps. So, should we...
Yes, I'm just waiting for this, and then I shall be in the car across the ferry, and yeah, we're going to do Scandinavia this summer.
I sort of see that written all over their faces.
They got the sweetest face.
Aren't they
Jojo's
just?
smiling.
Before James goes ahead with the vaccinations, he needs to check Jojo and Billy are microchipped, an essential requirement for travel,
Very good.
and give them both a once-over.
Okay, that's fine.
All good with that?
I'm happy with her, yeah. So let's give her the rabies vaccination. Okay. So it's just up in the scruff, yeah. So we'll post a treat at that end. There we go.
Good girl.
Well
done, Jojo. Well done.
There. She's like, just give me the treats. Right, let's give Billy his vaccination as well. Okay, right, should we do it here? This is fun. Beautiful. There. She's like, is that a treat? Can I eat that? Well done, team. Right, so that's the vaccinations done.
Yep.
So the next step will be when you have a definite travel date, as long as it's 21 days from today, beyond that, we can then book you in for the certificate appointment. Great, okay,
Good.
well, bon voyage.
Wonderful. Thank you very much.
It's been an action-packed day at the surgery, but before the team can finish, Ruby has arrived to collect her Cocker Spaniel, Naya.
Here she is.
Hi, little girl. Hello, puppy. How are you, Naya.
Here she
Oh,
is.
she's not interested.
Yeah.
Come in, darling.
Hello,
She's got a new friend.
Who's been a
Hi,
good
bud.
girl?
There we go.
James did an amazing job. He was so calm all through.
Thank you, James.
She's
Bless
been
her.
very well behaved.
She was,
She
wasn't
was really
she?
good behaved, yeah. I probably wouldn't necessarily walk her today.
No, I
just
wasn't
keep her
going
nice
to.
and rested. Keep it covered, keep it clean, keep it dry. I'm sure she'll
How long
heal
does
up.
that stay on for?
So we'll keep that on for maybe a couple of days,
Uh-huh.
but it might peel off on its own.
Yeah.
So don't worry too much. But
That's okay then. Hello, puppy. How are we?
I was a very good girl, Mummy.
so we'll give you a call when we've got the results back, and
Excellent.
we'll see you next week for post-op check.
Right, excellent. Thank you so
Okay?
much. Thank
All
you,
right.
James. I really
Pleasure,
appreciate
no
it.
worries.
Thank you so much for watching over her.
nice to meet you, Ruby.
Thank you. Thank you so much.
Oh,
it was really
bye-bye.
kind of you.
Really
Bye-bye
nice
now.
to meet you.
And you.
Bye,
Bye-bye now.
bye.
Okay. See you
Thanks,
soon.
James.
No
Take care,
worries.
James.
Yeah,
Bye-bye
take it
now.
easy.
Success.
So cute.
Another one.
Yes.
Well
We
done.
need you to stick around. I think you're a good omen in
Do
this
you think
practice.
so?
I do.
Sadly, I can't stick around, but my goodness, I've enjoyed my time here, inside the vets.
Now I'm in love with her.
Oh, look at you two.
Hey, wobble chops.
Just having a nice little snore.
Oh.
This is great news.
Oh, I love liver breast. This is Arthur, the most chilled cat I think I've ever met. And I've enjoyed meeting all the animals that we've met over the last few weeks, big or small, young or old. They've all been adorable, and they've all had one common denominator, and that is that they have owners who simply adore them and will do anything in their hour of need to help them. The vets here have been incredible. They treat their patients with such wonderful respect. And you know what? The bond between animal and human is so strong and very much alive and kicking.
I thought you were a vet, not a dentist.
Fern Britain Inside the Vets, brought to you by Petplan.
Lights are flashing, colors glowing here. Hearts wide open, welcome, brand new year. New dawn rising, skies are bright and clear. Dreams igniting, every soul sincere. Count it down, let the joy begin. Step into the world we're living in. Shout it out, let the laughter ring. Welcome to the night, we'll dance and sing. Champagne bubbles, sparkles in the eyes. New Year's coming, leave the past behind. Resolutions, dreams are reaching high.
Over into the EU or any of the other listed countries. But once that 21 days has passed, what you can then do is come down for what we call an animal health certificate, and then you need to then see a vet within 1 to 5 days of your return in that country to have a tapeworm treatment to be able to come back to the UK. So there are quite a few steps. So, should we?
Yes, I'm just waiting for this, and then I shall be in the car across the ferry, and yeah, we're going to do Scandinavia this summer.
I sort of see that written all over their faces.
They got the sweetest face.
Aren't they
Jojo's
just?
smiling.
Before James goes ahead with the vaccinations, he needs to check Jojo and Billy are microchipped, an essential requirement for travel,
Very good.
and give them both a once-over.
Okay, that's fine.
All good with that?
I'm happy with her, yeah. So let's give her the rabies vaccination. So it's just up in the scruff, yeah. So I'll post a treat at that end. There we go.
Good girl.
Well done, Jojo.
Yeah,
Oh, there. She's like, just give me the treats. Right, let's give Billy his vaccination as well. Okay, right, should we do it here? This is fun. Beautiful. There. She's like, is that a treat? Can I eat that? Well done, team. Right, so that's the vaccinations done.
Yep.
So the next step will be when you have a definite travel date, as long as it's 21 days from today,
Yeah.
beyond that, we can then book you in for the certificate appointment. Great, okay, well, bon voyage.
Wonderful. Thank you very much.
It's been an action-packed day at the surgery, but before the team can finish, Ruby has arrived to collect her Cocker Spaniel, Naya.
Here she is.
Hi, little girl. Hello, puppy. How are you, Naya?
Here she
Oh,
is.
she's not interested. Come here, darling.
Hello,
She's got a new friend.
Who's been
Hi,
a good
bud.
girl?
There we go.
James did an amazing job. He was so calm all through.
Thank you, James.
She's been
Bless
very
her.
well behaved.
She was,
She
wasn't
was really
she?
good behaved, yeah. I probably wouldn't necessarily walk her today.
No, I
just
wasn't
keep her
going
nice
to.
and rested. Keep it covered, keep it clean, keep it dry. I'm sure she'll
How long
heal
does
up.
that stay on for?
So we'll keep that on for maybe a couple of days,
Uh-huh.
but it might peel off on its own.
Yeah.
So don't worry too much. But
That's okay then. Hello, puppy. How are we?
I was a very good girl, Mummy.
so we'll give you a call when we've got the results back, and
Excellent.
we'll see you next week for post-op check.
Right, excellent. Thank you
Okay,
so much. Thank
all
you,
right.
James. I really
Pleasure,
appreciate
no
it.
worries.
Vern, thank you so much for
Very
watching over
nice
her.
to meet you, Ruby.
Thank you. Thank you so much.
Oh,
it was really
bye-bye.
kind of you.
Really
Bye-bye
nice
now.
to meet you.
And you. Bye-bye now.
Bye.
Okay. See you
Thanks,
soon.
James.
No
Take care,
worries.
James.
Yeah, take
Bye-bye
it
now.
easy.
Success.
So cute.
Another one.
Yes.
Well
We
done.
need you to stick around. I think you're a good omen in this
Do you
practice.
think so?
I do.
Sadly, I can't stick around, but my goodness, I've enjoyed my time here, inside the vets.
Now I'm in love with her.
Oh, look at you two.
Hey, wobble chops.
Just having a nice little snore.
Oh.
This is great news.
Oh, I love liver breast. This is Arthur, the most chilled cat I think I've ever met. And I've enjoyed meeting all the animals that we've met over the last few weeks, big or small, young or old. They've all been adorable, and they've all had one common denominator, and that is that they have owners who simply adore them and will do anything in their hour of need to help them. The vets here have been incredible. They treat their patients with such wonderful respect. And you know what? The bond between animal and human is so strong and very much alive and kicking.
I thought you were a vet, not a dentist.
Fern Britain Inside the Vets, brought to you by Pet Plan.